Welcome to the Cabral Concept, where board-certified naturopath and integrative health practitioner Dr. Cabral shares how he was diagnosed at the age of 17 with a life-altering illness and given no hope for recovery. It was only after studying and traveling all over the world did he discover how to combine ancient Ayurvedic healing practices with state-of-the-art naturopathic and functional medicine to fully rebalance the body and re-energize it with life. It's time to discover how to get well, lose weight, and finally feel alive again. And now, here's your host, Dr. Cabral.
Welcome back, everybody. We're here today on episode 2676 of the Cabral Concept. This is our second Cabral HouseCall of the weekend. If you want to follow along with the questions from the community here today, these have all been submitted over the past couple months. Remember, we're about 10 to 12 weeks in the queue. That's about how many questions come in about a 12-week period of time. We get to about a dozen questions a weekend. If you want to follow along with today's questions, head on over to stevencabral.com/2676. And while you're over there, just make sure you get your free copy of The Rain Barrel Effect. If you haven't already gotten your copy, highly recommend you do so, because you can just grab a copy for you or grab one for a family member. Try to spread this knowledge to as many people as we can around this world. Remember, I'm literally one person. I do my best, or I try to do my best on a daily basis, but we need to spread this information. It's not my information, it's all of our information. It's things that honestly we should have been taught as children, but our parents weren't taught it, so we weren't taught it. We need to change our current generation as well as generations to come. All right, so let's get into today's questions. Again, no medical advice, medical treatment plans, medical cures, medical diagnosis, but something even better, figuring out the underlying root cause for why dis-ease exists in the body in the first place. All right, first question is from Luis. Luis says, "Hi, Dr. Cabral. I seem to be suffering from hyperthyroidism. I noticed you have courses on the thyroid, but most seem to be focused on hypo rather than hyper. I have constipation just about every day where my bowels feel constricted, along with what feels like vagus nerve irritation, electrical bangs going up from the neck to the head, and occasional cloudiness in my urine. 2 of my blood tests came back as over 11 milligrams per deciliter for calcium. My GI doctor has now referred me to an endocrinologist, but I would rather not take meds or have my parathyroid removed. If it comes to that, is there anything you can recommend? I should mention that I'm in my late 30s and prolific seamoss eater. I'm taking your full spectrum magnesium, vitamin K, but only finding minor relief. Thanks." Okay, happy to help with this. Again, not providing any medical advice. Constipation is a hypothyroid typical symptom. Diarrhea or loose stool is a hyper, but it doesn't mean, of course, that you don't have hyperthyroidism. Hyperthyroidism is typically a low TSH. I know that doesn't make sense. It's like low TSH, that's 0.5 and below, or even some people say now below 1. But what it means is that's TSH is thyroid stimulating hormone. So if you're not producing a lot of thyroid stimulating hormone, it means that your body doesn't need to make more, so you're in a higher state of thyroid production, or at least utilization. Great. So here's what it looks like though. Every one of your symptoms match up as high adrenal-based stress. And so we'd be able to prove this. Medical doctors can't because they don't run the lab, but something called a stress, mood, and metabolism test. It was one of the very first tests I ran at 19 years old to figure out what was wrong with me. So what's it going to look at? Okay, estrogen, progesterone, testosterone, DHEA, and cortisol 4 times throughout the day. That's what we need to be looking at. Because, and again, I don't know this, that's why we test and not guess. It sounds like to me, for you, that when you have constipation, when you have vagus nerve irritation, when you've got the electrical bangs, as you called them, the cloudy urine, which is basically protein, can be tissue breakdown, and high calcium, that you're in a state of high stress. High stress is typically characterized by higher levels of cortisol, or at least norepinephrine output. When that happens, there's bone breakdown, there's muscle tissue breakdown, especially in a fasted state, and it can begin to throw off the thyroid. The thyroid in the beginning could be hyperthyroid, and then eventually it may actually become hypo. If you run the big 5 lab tests, even better. If you can only run 1 lab, it is the stress, mood, and metabolism test. Keep the glands inside your body. Keep all the body parts that you can. Again, not giving you medical advice. You do what your medical doctors say as well. But I would run that stress, mood, and metabolism. That's at stevencabral.com/labs, called the stress, mood, and metabolism test. And that comes with a consultation. All right. consultation and a plan. I mean, there's nothing like it in the world. You can work with our team, or you can go to integrativehealthpractitioner.org and work with a level 2 practitioner. All right, Mike's up next. Mike says, hi, Dr. Cabral. Appreciate all that you do. Your podcast and book started me on my healing journey back in November of 2022. I hope to never look back. Same here, Mike. Appreciate you being a part of the community. I've done testing through Equalife and some work with your IHPs, as well as my local naturopathic doctor. I'm 32 years old. I've had CREST for a little over a decade. I understand everyone has their own root cause, and I'm working as hard as I can to uncover and fix my imbalances. However, I'm writing to see if you had any success in working with clients who are able to completely overcome their symptoms of CREST and scleroderma. I've yet to hear any success stories, and it's a confirmation that is never talked about, or it's a condition that's never talked about. Would love to hear a podcast or just get some insight into what worked with your clients that had this disease. Yeah, happy to help with this. But I want us to all think about, and Mike, I don't know if you've read The Rain Barrel Effect yet. Please read The Rain Barrel Effect. It's free. I pay about $7.49 for that book to be printed. And I pay for the book. I just ask you to pay the shipping and handling, that's it, which is like $7 as well. And so we ship that book for free all over the United States. If you want to get it as well, you can get it at stephencabral.com/shop if you're international. Why I want you to read that book is that you're looking at what you have, same one for me, as a specific condition in the body. I never healed, and neither does anyone else, until they think that they need to heal CREST, scleroderma, Raynaud's, which is a big part of this as well, Mike, or any other autoimmune or any other issue in the world. Because you're thinking about it as a disease instead of symptoms of an underlying root cause. There's no one vitamin, there's no one supplement, there's no one diet, there's no one exercise for CREST, which is basically for everybody else out there. It's essentially poor circulation to the extremities, the fingers and toes, calcium deposits, buildups, poor circulation like in Raynaud's, and that can affect the eyes, skin, connective tissue. Okay, so let's talk a little bit more about this. Why would someone have the poor circulation, the calcium deposits? Well, we just talked about this with our friend Luis before, or Lewis. We're going back to a stress, autonomic nervous system, sympathetic nervous system dysfunction. We need to figure out, why does Mike have an underlying condition that causes poor blood flow, potentially to the extremities, increased calcium deposits around the body, and why is this progressively getting worse? What's causing the inflammation? Is it heavy metals? Is it work, life, relationships, childhood trauma? Again, that's often overlooked. That's why, again, you have to go into the rain barrel effect. Is it diet-based? Is it food sensitivities? Is it gut-based issues? Is it viral? Is it Lyme? Is it mold? So again, there's about 12 major things that it could be. And then we start to peel back the onion. Everything is fixable, Mike. Everything is fixable. And yes, we've helped people overcome this as well. Because we don't work on the specific disease. To me, the names don't matter. There's always an underlying root cause, or usually causes, and we go about rebalancing those. My highest recommendation is the Big 5 plus the bacteria and parasite stool test. When you have hard to treat conditions, you go and you look for all of the possible underlying root causes, and the Big 5 plus the bacteria and parasite stool test is ideally the way to go. All right. Next, thank you, Mike, for writing in. Oh, I almost skipped a question. This one is from Anonymous. Anonymous writes in, hi, Dr. Cabral. I've been on a journey to find answers to vaginal and vulva itch for years. I went the route of gynecology. They said I have lichen stenosis, told to take hormones. I didn't really want to do that, so I tried traditional Chinese medicine. There I tried yin care and some other supplements. Itch continues. I then went to a naturopath and got estriol and some cortisol balancing. I use hydration ovals. This didn't work. Throughout this 5-year journey, I did over-the-counter yeast treatments. Then I couldn't cope for a couple of days or a month of relief. When I couldn't cope for a couple of days or months of relief. That's important, everybody. We're going to go back to that one. Then I started protocols with your testing and health coach. Organic acid test pointed to elevated levels of suspected yeast. That's the second major point, everybody. I did a detox, limited yeast sensitive gut guide, midway into probiotics, symptoms came back. Now what? I need help. Okay. Almost always, not always, 8 out of 10 times, these lichen-based issues, vulva, vaginal itch, genital itch in males as well, is linked to yeast and fungal overgrowth, internally and externally. We need to work on both. Anonymous, I have lots of podcasts on this as well. And that's why if you're new to the show, love having you here, really do. I want to make sure, again, I know that there's, excuse me, need to clear my throat. I know that there's over 2,600 podcasts. You can use the search box at stevencabral.com/podcasts. Search lichen, search vaginal itch, search yeast infection. You found the issue 2 ways. One, you found it using the Candida metabolic and vitamins test through our practice. You saw elevated levels of yeast. Okay. The second way is that you did yeast protocols before and you got results when you just couldn't take it anymore, you had to do them. We're looking at a yeast issue, internal and external. Again, this is not a medical diagnosis, but I've seen this well over 100 times in my practice, at least. So here's what we do. I know that your coach wanted to give you the easier way to do it, which was a limited yeast, and I like that, and I appreciate that. Most likely, we need to do the full CBO protocol with citricidal drops. And we most likely need to work topically as well. So the CBO protocol, stevencabral.com/CBO, thousands of healthcare practitioners around the world use this protocol as well with their patients and clients. It's been used now and really solidified over the last decade. Okay, so then topically, what else can we use? Well, we need to use a very small amount just to see that you're not sensitive to it. Coconut oil, potentially apple cider vinegar, potentially boric acid suppositories, potentially lactobacillus acidophilus suppository, vaginal suppositories we're talking about. All of these things can be highly beneficial. So we do the CBO protocol. We're not going to do the topical yet. We'll probably do that after about 3 weeks on the CBO protocol, and then you'll work the topical as well. We will work on the yeast on the external as well as the internal. All right? Again, not a medical diagnosis, not a medical treatment plan, but that's where I would start. And again, please do work with an integrative health practitioner or equal life coach for your journey to be able to go back and forth with feedback, okay? And then we need to stabilize because it doesn't look like you were stabilized, and that's why it started to come back. Okay. Nurse Coach Robbins is up next. Thank you for all the information that you provide the community. You are making a difference and are so appreciated. Thank you. I appreciate that, Coach Robbins. I would like to know your opinion on microcurrent point stimulation on acupuncture sites for overall pain relief, increasing vagal tone, and increasing heart rate variability with appreciation for your guidance. All right, happy to help with this. I am an advocate of this when done right. It should be done by someone with TCM, traditional Chinese medicine, acupuncture point knowledge and training, or an Ayurvedic-based specialist with Marma point training. And they're very, very similar. It's amazing, right? Different continents. I shouldn't say different continents, different countries, different lineage, different teaching. But there is this very amazing synergies between the different meridian and energy points of the body. So, no, I'm an advocate. I'm going to be talking more about vagal tone stimulation and heart rate with improvement in heart rate variability. So I'll certainly be talking about this, the different points in the air specifically, above the lip, between the thumb and the forefinger, a few others as well, the solar plexus. So no, you work with the right person. It can be powerful. Same with laser or just basically light photons can be very powerful and helpful. So yeah, I think you're in the right direction there, Nurse Coach Robbins. Appreciate it. All right, Bettina is up next. Hello, Dr. Cabral. Thank you so much for this great podcast that you do. I've decided to get a mini tummy tuck, mini abdominoplasty with some liposuction above the umbilicus. I will not have my abdominal muscles tightened as the issue is more the hanging lower stomach and excess fat in that area. What would you recommend me doing prior to surgery and after? Surgery will take place mid-September this year. I did the 21-day detox in January and plan to do either a 7-day or 14-day before July. I have been told to stop taking my cod liver oil 3 weeks before surgery. If a family member of yours chose to do what I'm going to, what would you recommend them doing? Thank you so much for your time. I truly appreciate it. I like how you're always saying, not for me, but, and I know you're not giving medical advice, but what would you recommend for yourself or a family member? Exactly. That's what I'm going to recommend. Okay. So the thing is, though, I would love people to also go to stevencabral.com/podcasts, not because I don't mind answering it, because I don't mind at all, but you would get your answer like 3 months sooner, right? And so that's why I want you to do it. So I have the same recommendations for surgery. If you have to take antibiotics, then I'm recommending that you would then use the clean gut probiotic and the healthy gut support for 4 to 12 weeks after surgery, once you're cleared, right? To help counter the effects of antibiotics, all right? After that, and along with that, advanced collagen support, that will work with the glutamine inside of the healthy gut support to help repair tissue damage. I would also recommend the immunity protocol post-surgery, as long as it doesn't conflict with any medications you're given, because it has extra vitamin D, extra vitamin C, and extra zinc for tissue repair as well. This is always on top of the daily foundational protocol. The daily foundational protocol, you would have to just pause, though, if you're on blood thinners, because it contains the daily omega-3. You're using cod liver oil. We use the daily omega-3. Your physicians are right to tell you to stop taking that a few weeks before surgery because it is a blood thinner and could cause complications like excess bleeding during surgery. Okay, pre-surgery, you're on an anti-inflammatory diet plan. They have found that those people with less inflammation going into surgery, the healthier you are, the faster you recover. All right, so those are my just initial recommendations. All right, we are going to keep it at that for today. Thanks so much for tuning into this Cabral House Call, as always, each and every weekend. And tomorrow we'll be back with our Mindset and Motivation Monday. Don't miss it. One of my favorite ways to start the week. Take care, everybody. Hope you had an amazing weekend. Before you go, I wanted to ask you this question. What if I could teach you in just a couple of hours how to transform your thyroid, hormones, adrenal, cholesterol, blood pressure, blood sugar, weight loss, energy, mood, brain, pregnancy, anti-aging, or many other health-related issues? After 20 years in private practice, after seeing and overseeing 250,000 client appointments, I sincerely feel I have the real-world data and have found the answer you've been searching for. So what I've done is spent hundreds of hours of my own time refining what you need to know in order to uncover your underlying root cause health issues and then begin to rebalance the body and bring it back to a state of robust health and wellness. I'm going to teach you exactly what I do in my private practice so you can understand how you got here and now what you need to do in order to heal. You'll receive all of the important success checklists, protocols, and even ways to customize it to make the program fit your busy life. And you'll get all of this at a fraction of the price. Let me save you the time, money, energy, stress, and frustration of not knowing what to do next. Instead of reading dozens of books on the topic and seeing multiple practitioners, I will condense everything that you need to know in just a few hours of video tutorials that you can watch and listen to anywhere. Together, we will make this healing process an enjoyable one that you can take with you for the rest of your life. I wish you all of the best of health and happiness, and I hope to be able to guide you on your healing journey through my health results accelerators. Simply choose the health imbalance you're currently suffering from, and by the end of today, you'll know what went wrong and how to get well again. I guarantee it. For details, head over now to stevencabral.com/courses.